fantastic day. This is our second RAP, so we were the first local health district in New South Wales to have a RAP back in 2017, and this builds on that foundation, taking us to the next level where we want to be more innovative and reconciling the gap between Aboriginal people and their experience of healthcare and non-Aboriginal people. Our commitment is that we actually want to improve the experience that Aboriginal people have of our services.
So in our first RAP, we had 52 deliverables and 13 actions. We've been quite ambitious with our Innovate RAP and have 16 actions with 76 deliverables over a 2-year period.
It's important that for us to deliver on these actions is that there's real and meaningful commitment, that there's real engagement, there's really good collaboration, and certainly, if we can certainly partner with other services throughout the district, both internal and external to the organisation, I'm sure that we can certainly have improved health outcomes for Aboriginal and Torres Strait Islander people that live in and reside within Western New South Wales.
We are well down the pathway of reconciliation in Western New South Wales. That of course doesn't mean that we are there or that we've arrived. It simply means that we have got a clearly defined vision of where we are heading, and we are prepared to roll our sleeves up and do the hard work to get there.
In a big complex health systems, we never get it right 100% of the time, but unfortunately what we also know, when we talk to Aboriginal people, members of our community, they talk about their experience in less favourable terms than non-Aboriginal people do. And even when we look at some of our clinical incident data, unfortunately, Aboriginal people, the reality is they're more at risk in our services than non-Aboriginal people, because they show up and their care shows up, gaps in their care show up far more frequently than for non-Aboriginal people. And we want to do something about both of those things. It's not because any one of our staff is consciously doing anything differently, but it's perhaps because we're not listening, because we're not walking in the shoes of the Aboriginal people coming to us for care. We're not understanding really what it is that they need to have a really good experience and a safe experience from us all of the time.
So the message that we're giving to our communities is that we want to improve, we want to challenge our system, we want to eliminate unconscious bias, we want to work towards a safe environment where our communities, our patients, our families feel safe to get the care that they deserve and that they need.
Our absolute ambition is that unconscious bias is something we're going to tackle over the next couple of years together in a respectful and a safe way, so that we are really understanding what Aboriginal people want for us. So whether it's things in who's not waiting for services in an ED, whether it's people discharging themselves against medical advice, all of those kind of key indicators, whether it's following people up within 48 hours of them being discharged, whether it's the number of staff that we employ who identify as Aboriginal, all of those things we want to improve going forward.
For us to achieve true and appropriate reconciliation, I think the important thing is it's around having respectful relationships, having good community engagement. It's around delivering on what we say we're going to deliver on. It's about measuring what we're actually doing, and it's at the end of the day, it's the voice of the community that should be holding us to account around delivery of appropriate healthcare at the right place, at the right time, for the right people.